So for my physical assessment, I'm going to state my 12 rights to begin. I'm going to verify the care order for my patient, perform hand hygiene before and after patient care, handling equipment and supplies. I'm going to verify facility policy and procedure and gather appropriate equipment and supplies. I'm going to consult manufacturer's recommendation when equipment is involved. I'm going to knock on the door, identify the patient using 2 identifiers, note the overall condition of my patient. I'm going to provide for privacy and explain the procedure to my patient, raise the bed for good body mechanics, don PPE if indicated, and upon completion, I'm going to lower the bed and raise the side rails according to my patient's care plan. And I'm going to place the call system within reach, and if I have any abnormal findings, I'm going to report those to the charge nurse immediately. So I have my patient here for my physical assessment. Could you state your name and your date of birth, please?
Michaela Wharton, 2/28/2000.
Okay, so my patient has appropriate growth and development for her age and gender. I'm gonna fix this. She shows no signs of distress. She has no striking features. I'm gonna take her height, weight, and vital signs and record those compare those to baseline data. She is in appropriate behavior. She has in a good posture. Her hips and her shoulders are aligned, and she has no slump or bend. She is clean. She doesn't have any distinct odors. Her hair, skin, and nails are clean, and she also has appropriate speech and responds to questions and commands appropriately. So for her skin, she is darker pigmented. It is distributed evenly throughout her body. It is smooth. She has no lesions noted. Her skin integrity quality is whole, intact, and uniformed throughout the whole body. So I'm going to check her skin turgor on her forearm, and her skin turgor is great. It bounces back within 3 seconds. For older adults, I can check that on her forehead or their sternum. Her mucous membranes, I'm going to look at those. They're pink and moist with also no lesions. Okay, so for her hair is coarse. It is evenly distributed throughout her hair. It is dark brown, almost black. There's no presence of parasites. She has no hirsutism or alopecia. Her nail beds, so since she is a darker pigmented patient, her nail beds are going to be reddish blue but with no yellow. They are smooth. They're not rough or anything like that. They are rounded, no clubbing, and the nail bed's 160 degrees. I'm also going to check her capillary refill, so I'm going to push on it, and it refills within 3 seconds, so that's good. So next, I'm going to check her neurological. I'm going to look at her pupils with my pen light, so don't look at my pen light, just look straight ahead, and I'm going to see if her pupils react to the light, and they do. So now I'm going to have her look at a distant object on the wall, so look at that picture up there. Okay, and then now look back at my finger. So her accommodation, her eyes go in together, so that's good. Now I'm going to have you follow my finger side to side and up and down. So the eyes move evenly and together, so that's good. So now I'm going to have you stand up, please. So for the neurological, I'm going to assess if she can put your arms out to the side and close your eyes so there's no swaying. Okay, you can put your arms down. Now I'm going to have you walk in a straight line. She can do that well. She doesn't get dizzy. Okay, now I'm going to have you stand with your arms to your side and now put them out. Actually, keep those down. Yeah, she's going to keep her arms down for this one, and she's going to raise up one leg, and she can do that pretty well, and then raise the other leg, and she does that pretty well too. So her neurological seems great. Okay, you can have a seat. So next, I'm going to check her musculoskeletal. Okay, so I'm going to have her do range of motion on 2 joints, active or passive. So I'm going to have her do active. So I'm going to have you just move that, and I'm going to feel your joint. Good. So she has no pain, heat, crepitus, or edema in those joints. Now I'm going to have her do it on her lower extremity, so just move it out. Awesome. No pain, heat, crepitus, or edema on that either. So now I'm going to rate her tone on a scale of 0 to 5. So I'm going to have you put your hands like this, and then I'm going to have you push towards you. Good, she's strong. Now put your hands this way, and then push against me. Good. So her upper extremities, I would rate a tone of 5. Now for the legs, do the same thing. Push in, good. Then push up, good. Strong. So her legs are a 5 as well. And then also for musculoskeletal, again, she is sitting up straight with her shoulders and hips parallel and aligned, no slump or bend. So that is all I have for the first part of my physical assessment. For the second part, I'm going to first check her cardiovascular. So first I will check her heart rate, which should be between 60 and 100 beats per minute. And I'm going to check that at the apical pulse site. So I'm going to listen for 30 seconds, and you can multiply that by 2, but if it's irregular, I'll listen for a minute. Okay, so her heart rate was 72, which is normal, so the rate should be regular. I'm also going to check any of her pulses, so I'll check her pulse rate for also 30 seconds. And I guess you guys would have told us which pulse site to check, but the most normal used is on the wrist, thumb side, so we can check that. I'm also going to check for edema in the face and neck and extremities, and she has no swelling in any of that. So next, we have the respiratory rate. I will check her respiratory rate. It should be between 12 and 20 breaths per minute. So I would check that for 30 seconds. And then the depth of her breathing should be normal. It shouldn't be labored. And then I'm going to also look at her effort quality. It should be without difficulty. She should be breathing easily, effortlessly, which she is, so that's good. So now I'm going to check her chest expansion on her xiphoid process, and my hands should rise and fall evenly. So I'm just going to have you sit up straight and then take a deep breath. And my hands rose and fall evenly, so that is good. Have you had a cough recently?
No.
So she's had no cough, but if she did, I would ask her for how long, if she has any sputum and things like that. And then I'm going to also listen to her breath sounds in all of the areas, front and back. So I would listen. Each time I do this too, she would be taking a deep breath. So I'd listen here, to 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 here. And then I would go from the left side, or from the right side to the left side down, right side down, left side down, right side. And then I would also listen on the back in all of my areas just to make sure that her breaths are clear to osculation. So next, I'm going to check her GI. And for that, I would have her lay down, but we are not equipped for her to lay down in the kitchen. So I would walk you through how I would do that. So my patient would lay down. Her abdomen should be flat. It shouldn't be scaphoid or protuberant or anything like that. And I would check to feel for any masses or unequalization. I'm going to listen to her bowel sounds, starting in the right lower quadrant to the right upper quadrant to the left upper quadrant to the left lower quadrant. And the bowel sounds should be between 5 and 35. If they're under 5, they're hypoactive. If they're over 35, they're hyperactive. And if they're between the normal range, they're normal active. So I'm going to ask you, have you had any nausea or vomiting?
No, ma'am.
No, okay. So if she did, I would ask how often, how long she's had it, and then I'm gonna check for ostomy bags. If she does have an ostomy bag, which she doesn't, I would check the skin integrity, the pouch integrity, and then check the skin around it to make sure that everything's good with that. When was your last bowel movement? Yesterday. Okay, so her bowel consistency should be brown informed. There should be no presence of blood in that. And then also I would check the patency of her anus. So I would have her lay down on her side. The anus should be coarse, tightly closed, and darker pigmented. There also should be no presence of hemorrhoids. So for her genitourinary, I'm going to check her urine amount. If it's under 30, that is a problem and it would be reported. It should be between 1,200 and 1,500 milliliters per day. And then if she was post-surgery, I would keep a very close eye on that, on her output, her input and her output. So the urine should have no odor. Its consistency should be clear with no hematuria. And then I would ask her if she had any problems like with dysuria, nocturia, polyuria, things like that. Do you have any trouble peeing or no? Okay, so that's good. And then I'm going to check for ostomies as well and the genitourinary, and then check the skin integrity and the pouch and everything like that with that. And then also next we have the reproductive. So I'm going to I'm really going to teach her about her reproductive system. So for females, they should check it the 4th to 7th day of their menstrual cycle. After the shower is a good time in the mirror. So you would place one arm up and you would make sure you go up into the armpit. You have 3 techniques to check for masses. So one is circular, and then one is vertical, and then one is wedge. And if you feel any masses, pain, tender, edema, and things like that, you need to follow up with your healthcare provider. Also, if there's any cracking in the nipple or abnormal discharge, you would also need to follow up with your healthcare provider. And then I would also ask her when her last pap smear and cervical exam was. So she would tell me that. If she hadn't had one in a while, I would tell her how to follow up and do that. So for males, I'm going to show them the technique for how to feel for masses or lumps or unequalization. So they have the 2 fingers and the thumb. They need to do this once a month when they pay their truck payment. And the best time to do it is in the shower. I'm going to identify where the epididymis is, which is the cord-like structure above the testicles. And if they feel any masses, edema, pain, or anything like that, I'll tell them to follow up with their healthcare provider. And then if my patient is over 50, I'm going to ask him when his last prostate exam was and tell him how to follow up with that as well.